In this second part, we continue with high-yield psychiatry cases, focusing on developmental behavior and mood-related conditions. These cases will help you differentiate normal findings from pathology and recognize key clinical patterns for exams. Please note that this video includes sensitive mental health topics. This content is intended strictly for educational purposes to support medical learning. It is not meant for diagnosis or treatment. If you or someone you know is going through a difficult time, seeking help from a qualified healthcare professional is strongly recommended. You are not alone. Case 3: we have an 11-month-old boy who is brought to the office by his mother for a well child visit. The mother reports that the baby has been crying and screaming when other people approach him. She is concerned because this has been occurring for the past few months and seems to be worsening. She says that he used to enjoy being held by everyone, but now wants to be only with her and does not even allow his grandmother to hold him. The patient is crawling and can stand only with assistance. He babbles but does not say clear words and uses hand gestures to communicate. Growth curves are appropriate. On physical examination, the patient clings to his mother and begins crying, turning his head away when the physician attempts to interact with him. The question is, what is the most likely explanation for this behavior? Possible options include adjustment disorder with anxiety, autism spectrum disorder, normal development, reactive attachment disorder, and separation anxiety disorder. Although autism spectrum disorder may be considered, the correct answer is normal development. This patient's distress when interacting with unfamiliar people is typical of stranger anxiety, a normal developmental stage that begins around 6 months of age. It is characterized by crying, screaming, and clinging when unfamiliar individuals approach, even in the presence of the caregiver. The development of stranger anxiety indicates that the infant has formed a specific attachment to the primary caregiver and can distinguish that person from strangers. Stranger anxiety typically peaks around 9 months of age and resolves by approximately 2 years of age. Adjustment disorder would involve a response to a stressor that is disproportionate and associated with impairment, which is not the case here. Autism spectrum disorder should be considered if there is persistent poor eye contact, lack of joint attention, and no response to name between 12 and 15 months. However, in this patient, the behavior is consistent with normal development. Case 4: a 53-year-old woman comes to the office due to chronic anxiety and tension. She worries constantly about multiple aspects of her life, including work, finances, and family. She has difficulty concentrating and frequently calls to check on the safety of her husband and children. She also reports tension headaches, back pain, and fatigue. She denies feeling depressed and states that her sleep and appetite are normal. Laboratory results are normal. In addition to psychotherapy, pharmacologic treatment with buspirone is initiated. The question is, what is the diagnosis? This patient has generalized anxiety disorder. Her chronic excessive worry about multiple domains, along with symptoms such as muscle tension, impaired concentration, and fatigue, are characteristic of this condition. Another question is, what property is associated with this medication? Buspirone has no risk of dependence. It is a non-benzodiazepine anxiolytic used for generalized anxiety disorder and does not carry the risk of dependence seen with benzodiazepines.